After so many years, it's finally here. The official Republican bill to repeal and replace the Affordable Care Act. Welcome to a very special episode of Healthcare Triage. Let's start with Medicaid. Okay, the AHCA does quite a bit to Medicaid, and it's a little bit complicated. First of all, the bill leaves the expansion intact for now. Everyone who signs up by 2020 gets to keep their Medicaid if they're part of the expansion population. But in that year, entry into the expansion will be frozen, and people will only remain eligible if they don't have a lapse in coverage for more than a month. In some ways, this bill incentivizes states to sign up as many people as possible in the next 3 years so that they qualify for a higher match amount when that goes into effect in 2020. In 2020, Medicaid will change to a per capita block grant program, and we've covered what that means in a prior episode. The cap rises by medical CPI plus 1%. The initial rate will be set by looking at 2016 and then increasing spending to 2019 based on that formula. Now, CPI plus 1% is likely to rise more slowly than actual medical inflation. That could lead to somewhat of a drop-off in relative funding in 2020 if healthcare spending does increase faster than inflation from now until 2020. The allocated amount per person, again, we've covered this in a prior episode on per capita grants, is based on 5 groups: kids, the elderly, blind and disabled people, previously eligible adults like pregnant women and parents, and the expansion eligible or working adults. Lottery winners are not going to be eligible for Medicaid anymore. The Republicans spent a full 6 pages of the bill, which is really only like 66 pages long, discussing this. I have no idea why. There doesn't seem to be much evidence that lottery winners are burning up the Medicaid budget. The essential health benefits requirement for some Medicaid benchmark plans might go away as well. This seems to include the requirement that mental health services be covered the same as other health benefits. We should note this is specific to the Medicaid program and not to all essential health benefits. Retroactivity may change. As of now, you can get Medicaid today and have it cover your spending from up to the preceding 3 months. This is important because people can get coverage for things that occurred for some time before they signed up. The new bill proposes reducing retroactivity to the month in which beneficiaries apply. This is a huge deal. Additionally, states would have to redetermine eligibility for people on Medicaid at least every 6 months. Proving that you're continuously eligible is a lot of work for patients, and this will likely lead to a fair number of people losing coverage because this is much more of a pain than you think. Let's talk about other payments. Disproportionate hospital payments, or the payments hospitals used to get for caring for the uninsured, are restored immediately to states that didn't expand Medicaid and to all states in 2020. In 2018 and 2019, $15 billion is going to be allocated for states to do with what they want. They could make high-risk pools, or they could increase the size of the subsidies or tax credits, or they could reinsure insurers to protect them from really high-cost patients. From 2020 through 2026, that amount is reduced to $10 billion a year. To claim that money, states also have to match it in increasing amounts, from 7% in 2020 to 50% in 2026. Let's talk about subsidies. Anyone who maintains continuous coverage gets to keep community ratings, the idea that they can't be charged more even if they have a pre-existing condition. If, however, they let their coverage lapse for 63 days in a year, they get charged 30% more for the next 12 months. The subsidies change too. Now they're called tax credits, and here's a secret. They were tax credits before, so I don't understand. But now they're not based on how much you earn, they're based on how old you are. They also start to phase out when you earn $75,000 a year or $150,000 for joint tax filers. As you can see from this handy chart from the Kaiser Family Foundation, a 27-year-old will get a $2,000 credit, a 40-year-old will get a $3,000 credit, and a 60-year-old will get a $4,000 credit. That's true if they make $20,000 or $75,000. Under the ACA, they got more money if they were poorer and less if they were richer. Those making $75,000 get nothing now, for instance. This means that poorer people, especially non-young poor people, are going to have a much harder time affording insurance. People making more, ironically, are potentially in for a windfall. Cost-sharing subsidies are not appropriated for 2017, 18, or 19, and they're eliminated in 2020. Your subsidies also can't be used to purchase any insurance that covers abortion. Let's talk about the exchange market. There's no more individual mandate or employer penalty retroactive to 2016. Insurance companies are going to hate that. This will likely lead to some adverse selection. That's made worse, potentially ironically, by the 30% penalty for late enrollment. Healthy people, once they're out, simply won't buy coverage until they're sick, because you'll get the same penalty no matter when you get back in. Death spirals seem much more likely with this plan. Age bands, the difference between what you can charge young and older people for insurance, are increased from 3-to-1 to 5-to-1 starting in 2018. This will make insurance cheaper for young people and more expensive for older people. Let's talk about taxes. For 2017, all the taxes from Obamacare remain in effect. In 2018, though, they're gone. This includes the Cadillac tax, which is delayed until 2025, which is the same thing as getting rid of it. The medical device tax, the tax on high salaries of insurance executives, the Medicare tax on higher earners, taxes on insurance companies, pharma and tanning salons, etc., etc. And now some miscellaneous stuff. The bill defunds Planned Parenthood, but increases funding for community health centers. And people can now put even more money into their health savings accounts. The limit increases to at least $6,550 for an individual and $13,100 for a family in 2018. So what's untouched? Young adults are still covered by family plans until they're 26. Guaranteed issue and community ratings still exist, but they're subject to continuous coverage. Essential health benefits remain intact in the exchange market, including preventive services and maternity care. And annual limits and lifetime limits are still banned. So some concluding thoughts. Look, there's no CBO score yet, and it's hard to know exactly what they will find. And we're gonna definitely update this episode or put up a new one when that report comes out. But here are my preliminary thoughts. It's hard to see how this won't reduce insurance coverage. Many people will find the subsidies insufficient to buy care. Plus, the Medicaid slowdown with the per capita spending is going to mean that there'll be less and less money to the states starting in 2020 or so. It's also hard to see how this is going to lead to much of a deficit reduction in the long term. There's still a decent amount of spending in there and a declaration that many of the taxes and sources of revenue are going to end. That's unless they plan deep cuts to Medicaid in the future, which will come with its own issues. I'm also worried that this continuous coverage plan could actually make adverse selection worse. Why wouldn't a healthy person go without insurance for a couple years if all they're going to see is a 1-year 30% increase in premiums as a penalty? There's a fair argument to be made here that this is sort of Obamacare light. This is much closer to the ACA than previous Republican plans. There's still a fair amount of regulation. The Medicaid expansion is left intact until 2020. Subsidies still exist. Even the taxes don't go away right away. But this is still a big difference from the ACA. The subsidies shift away from the poor to others who are not as poor. And Medicaid undergoes a huge radical sea change in 2020. The bottom line is, please remember, this is still a bill. It's not a law. And it desperately needs a CBO score. Healthcare Triage is supported in part by viewers like you through Patreon.com, a service that allows you to support the show through a monthly donation. Your support makes this show bigger and better. We'd especially like to thank our research associates Joe Sevitz and Jonathan Dunn, and of course our Surgeon Admiral Sam. Thanks Joe, Jonathan, and Sam. More information can be found at patreon.com/healthcaretriage.